First Person Advisors is now a subsidiary of NFP, the fifth largest insurance broker in the world, combining local expertise with access to global capabilities and solutions. Learn more at firstpersonadvisors.com.
Everyone needs to act as if they have the virus right now. So test or no test, we need you to understand you could be spreading it to someone else or you could be getting it from someone else. Stay at home.
March 2020, the coronavirus beginning to take hold around the world, cases emerging at an alarming rate. One of the key figures on the front lines in the United States, Surgeon General Dr. Jerome Adams, a man with plenty of experience dealing with public health crises during his time serving as Indiana State Health Commissioner.
I came in right at the beginning of Ebola and had to work with people throughout the state to make sure they were prepared for a potential Ebola case. Thank goodness we didn't get one, but we actually put in a tremendous amount of work to make sure we could screen people and have resources available if they needed it. Then after that, it was dealing with an HIV outbreak in Scott County, Indiana, related to injection drug use. And then it was Zika. And then it was a lead contamination situation in East Chicago. So crises tend to follow me.
It's a long way from growing up on a farm in Amish Country in the rolling hills of Mechanicsville, Maryland, a path that has taken Dr. Jerome Adams to lead roles in battling public health issues at the highest levels in Indiana and nationally. Get to know him on this edition of the Business and Beyond podcast. Hello and welcome to this edition of the Business and Beyond podcast presented by PNC. I'm Gary Dick. You may know Dr. Jerome Adams best as the nation's 20th Surgeon General, a role he held for 4 years and one that thrust him into the public eye during the pandemic. He found social media to be a key in reaching the masses to get the word out on the dangers of COVID. He even made a video on how to make a mask out of a t-shirt that went viral on Twitter. Before becoming the nation's top doctor, Dr. Adams served as Indiana State Health Commissioner for 3 years. He has called Indiana home since his days studying to be a doctor at the IU School of Medicine and currently serves at Purdue University as a presidential fellow and the university's first executive director of health equity initiatives. And I'm very pleased to be joined by Dr. Jerome Adams on the podcast this week. Jerome, welcome to the podcast.
Thank you so much. It's good to be on the podcast. It's good to be back in Indiana. And it's good to see you again. The last time I saw you was at Fox Garden up here in Fishers.
Hey, I was going to ask you, you're back in Indiana now. Have you been to Fox Garden since you've been back?
I absolutely have. It's just a stone's throw away from my house. And, I always get to see the most interesting people there, like you.
And great food, too. But it is great to see you. You were a frequent guest on the TV show, and we always enjoyed that. But your time away from Indiana has been interesting, to say the least.
Exactly. I mean, I tell you, I couldn't wait to get back here because I don't know what happened when I went out to Washington, D.C., but a tsunami followed me.
Well, talk about that. How would you characterize? So, it was 4 years, right? 4 years as Surgeon General.
Correct. It was just under. So, yeah, it was a 4-year term. And what a lot of people don't know is that the Surgeon General actually is a term. It's not supposed to end with the presidency, but President Trump let go of the prior Surgeon General, and so I think that that, among many other reasons, mostly to do with politics, contributed to this president choosing not to keep me on for the end of the term. And that's one of the things that I think really epitomizes some of the trouble we're having with public health. It's that it's all become politicized. It's all about deciding which party you lean towards or which tribe you're with. And then we view what you say through that lens.
Wow. Yeah. Boy, I don't know where to start. How would you characterize your leadership? Because you were certainly very visible, a very visible leader, very vocal. You were in the public eye, really in focus. How would you characterize that experience during the height of the pandemic?
Well, it was crazy. There's no other way I can put it. We were working 16, 18, 20-hour days. We were trying to fly the plane as we were building it, quite frankly. We were doing it with less than full transparency from China and our partners around the world. And we were doing it in the midst of an incredibly divisive climate. This would have been a once-in-a-century pandemic, no matter which way you sliced it when you look at the science. It would have been historic no matter what. But it was superimposed on top of the most divisive presidential election of the last several decades. Also, you had a social justice movement, the likes of which we haven't seen since the 60s, mixed in with that. Any of these stories by themselves would have been the story of the year. We had all three collide. And Gary, the real challenge is I'd go out and talk about the disproportionate impacts that this pandemic was having on people of color. And people would think I'm talking about George Floyd and view it through that lens.
Yeah.
Or I would say wear a mask or get vaccinated. And people would assume that meant I'm supporting one presidential candidate over another presidential candidate. And the fact is, I was just trying to be a doctor and give people the advice they needed to stay healthy and safe.
Mm-hmm. So it kind of underscores, I'm guessing, what many people would say is the dysfunction that exists in Washington generally, but with the public health overlay in this one, the impact had some dire consequences.
Oh, it absolutely did. It made it incredibly difficult to just get basic health information out to folks, and it made it difficult for them to hear that health information. I'll give you a really quick story. I'll be brief here, but I think it epitomizes the challenges that we faced. When President Biden won the primary over Bernie Sanders, it was June of last year, he said, if I become president, I will enact a national mask mandate. And I was asked on national TV, do you agree with President Biden that we should have a national mask mandate? And I told the truth. I said, we do not have the federal authority to enforce a federal mask mandate. However, I recommend that people wear masks, and I will continue to work with governors to help them understand why they should be encouraging mask wearing in their states. That is what I said. I got ripped to shreds from the likes of Don Cheadle. Axl Rose famously called me a piece of something that we can't say on the podcast.
Uh-huh.
And the truth is that you look back now, 9 months after inauguration, we still don't have a national mask mandate. Why? Because there's no federal authority. And so I told the truth, and I got ripped to shreds because people heard what I was saying through their political lens. President Biden, and I don't say this to be negative against him, but quite frankly, he said something that didn't turn out to be true, didn't keep his campaign promise. And those same people have no problem with it. And again, for me, it's just being a doctor, telling people the truth as I've experienced it and know it. And it's incredibly challenging in this climate.
You mentioned it was like, building the plane while you were flying it, I think out of necessity, because something like this had not happened before. That had to be, in some of these meetings, the sense of urgency that was needed. I mean, it had to be kind of scary in a sense, knowing what was happening, trying to get your arms around it, everyone, trying to get everyone on the same page. Was there a level of fear that was involved as you had these meetings, trying to come up with solutions?
Well, one of the things that I think prepared me well for this position was my experience as an anesthesiologist working at Eskenazi, formerly Wisher Level 1 Trauma Center. And I still practice, Gary. I actually practiced the entire time I was Surgeon General of the United States, the first Surgeon General to ever do that, working at Walter Reed with the Wounded Warriors. But when I'm in the operating room, you're having to make life and death decisions. You do it with the best information and the best intentions. And sometimes you don't always get it right. And, you look back and you try to do better the next time, but you can't get them all 100% perfect. And that doesn't mean that you're a bad person or that you are a bad doctor or that you didn't do everything that you could have or should have done. And that was a real challenge. I'll tell you about this through the context of COVID with an example. When we famously told people that they shouldn't be wearing masks back in February of last year. that was based on the information that we had available. We did not know there was a high degree of asymptomatic spread because China kept that information from us. And we felt there was a real harm in people hoarding masks because at the time you had healthcare workers who literally could not get the tools that they needed to work in the hospital safely. So we felt that not only was it the right thing to do to tell people not to wear masks based on the information that we had, we actually felt we would have been doing harm to our fellow healthcare workers, Dr. Fauci and I, if we didn't actually go out and make that announcement. Now, that said, the information changed. We finally got the information out of China about asymptomatic spread, and we quickly pivoted. But people have held that against me and us as a reason why they can't trust science. What I say to people is that's exactly how science works. You do the best you can with the information you have, but you have the courage, the conviction, the humility to keep looking for new information. And if you find out that that you need to change your recommendations, that's what you do.
Do you have any thoughts, Jerome, on where the virus originated? Obviously, that's a very controversial topic. Whether it was man-made in the lab, whatever the deal. What's your take on that?
Well, as you mentioned, it is a hot question, and there is a lot of controversy behind it. But here's the way I talk about it with people in my family or in professional settings. The fact is, we will likely never get a true answer to this question. And the real question we should be asking is, why was China not more forthcoming with information that could have helped us respond to this pandemic better? When you look at lives lost, the real opportunity for us to have saved lives within that time frame when we didn't have the information that China had, and we would have changed our recommendations. We would have reacted differently. We would have closed down the borders sooner. We would have told people to wear masks and reacted differently earlier on. That's the real question that people should be asking, not what is the origin of this virus necessarily, but why it has been so hard for us to get information about this virus from the country where we know it originated one way or the other.
Yeah. We're going to talk about growing up in Maryland, how you got to Indiana, but to kind of put a bow around the coronavirus discussion, 2017, I believe you were nominated to be a Surgeon General. Talk about that, how that came about, how you got the call, what that whole experience was like.
Well, it was a fascinating experience. And what's interesting is there were a lot of people from Indiana in the last administration. And when you think about it, it actually makes sense. You had a president who had no political experience. And so he leaned heavily on his vice president to help him fill out the government. And Vice President Pence had a lot of connections from his time in Congress, but also his time as governor. And he leaned on those connections to help fill out a government at a time when both Democrats and Republicans, in many cases, were hesitant to be part of this new administration. And as far as my case, it was Vice President Pence who made the call to me. And he said, "Hey, Jerome, we got a job to do, and I need you." He said, "I need you to come out and help us." And I come from a family that has served in the Navy, served in the Army, strong tradition in the military. And I believe in public service. And so when the Vice President of the United States calls you and says your country needs you, you don't waver. You say, as long as I can serve, I will do my best. And so that's how I ended up, in Washington, D.C. Interestingly enough, I was the first Surgeon General in modern times to have school-age kids. So that was quite a challenge to have. My kids are now 17, 15, and 11. So they were 14, 11, and 7 when we moved out to Washington, D.C. And so I'm dealing with a pandemic while at the same time I'm just a dad trying to figure out how to do virtual schooling. Yeah. And dealing with frustrated kids who can't play sports and who can't be around their friends. And I think that gave me a degree of credibility because when I'm standing in front of that microphone, I'm telling people not just what I think they should do as a doctor, but I'm telling them what I think we all should be doing as a father, as a husband, as someone who's living through this in a very real capacity. So, I'm proud to serve. It was a really tough time. What people also forget is that we had 3 Category 5 hurricanes in the beginning of of my tenure. And that was an incredible challenge. That was our largest deployment in history from the Public Health Service prior to COVID occurring. We also had an opioid epidemic, person dying every 11 minutes of an opioid overdose. And unfortunately, that got worse during the pandemic, 30% increase in overdoses. And it's why we've got to get our handle on this pandemic. We've got to figure out how to walk and chew gum at the same time, because people are still dying from uncontrolled high blood pressure, from opioid overdoses, from maternal and infant mortality. At the same time, we're fighting over COVID and whether or not people should get vaccinated or wear masks.
Yeah. Yeah, I want to ask you about the opioid crisis that you dealt with, certainly here in Indiana, as your time as state health commissioner. But one more question before the break. And you mentioned the phone call from then Vice President Pence. What was that like? I mean, did it come out of the blue? Did you think this might be a possibility? What were your emotions when you, kind of said, hey, I may be the next Surgeon General of the United States?
Well, I can't say that it was unexpected, because Pence was the vice president. And I figured he might be calling me in some capacity. I didn't know in what capacity it would be, but I still was incredibly honored. It's very interesting. And I know we're going to talk about my history after the break, but poor Black kid, grew up in rural Southern Maryland. Pence and I are an odd couple. You'd never look at us and think that we are as close as we are. But whether people like him or not, he is someone who has always been a big supporter of mine, a big advocate of mine, a big sponsor of mine, and tried to open doors for me and given me the opportunity to thrive, both as state health commissioner, one of the youngest in Indiana history, and then as Surgeon General of the United States, again, one of the youngest in history. And so I was honored to serve. And again, never dreamed I'd be Surgeon General of the United States when I was a little kid. So I'm proud to be able to have served in that capacity. And I hope that I can serve as a role model for other people out there who maybe didn't think that they'd ever have a chance to be in the White House, standing next to the president and the vice president and talking to millions of people about how to stay healthy.
I think there's little question that you have certainly served as a role model. And we'll talk a little bit more about your youth growing up in Maryland, how you got to Indiana, and a lot more when the Business and Beyond podcast continues. Stay with us.
First Person Advisors is now a subsidiary of National Financial Partners, the 5th largest insurance broker and consultant in the world. Develop your total reward strategies all in one place with the combination of First Person's local expertise and NFP's global resources and integrated solutions. Learn more at firstpersonadvisors.com.
Welcome back to the Business and Beyond podcast presented by PNC. My guest this week, Dr. Jerome Adams, former U.S. Surgeon General, former state health commissioner, and now a presidential fellow at Purdue University, also the school's first executive director of health equity initiatives. And Jerome, you have already at a young age accomplished much, and you're a long way from Maryland, I would say. Talk about your youth and growing up. Did you grow, as I understand, you grew up in Amish country?
I did. One of my best friends growing up was a little Amish boy named Jacob who lived on the other side of the fence from us. And so what's interesting about that is I very early on in life grew up realizing that people lived differently than I did. And it encouraged me to have a tolerance for different people, different lifestyles, different cultures. But I grew up on a old farm. Interestingly enough, as Surgeon General, I tell people the irony is that I grew up on an old tobacco farm and made money working in the tobacco fields.
Wow. Yeah, that's ironic. Yeah.
It is ironic, but it's also something that I took with me to Washington, D.C. I don't shame people because I understand that people make the decisions that they feel they have to make to support their families and their livelihoods. And it's easy to demonize someone for working in a coal mine or demonize someone for saying they want to go back to work in the midst of a pandemic. But the fact is that you do what you have to do to put food on the table and to put clothes on your back. And that's something I learned very early on, even as a kid with asthma who was very much allergic to tobacco. It sent me to the hospital several times, but I did what I had to do to earn money and contribute to the family. And so when I came to Indiana, interestingly enough, I felt an affinity for a lot of the folks here, because once you get outside of Indianapolis, Indiana gets pretty rural pretty quick.
Yeah, very true.
And it was a lot like where I grew up. When we think back to the Scott County HIV outbreak that we had, that I dealt with when I was state health commissioner, driving down the Scott County, that wasn't foreign to me. That was just like the area where I grew up. And I was able to relate to those folks. They were able to relate to me. And that's why we were able to get a syringe service program over the finish line and become a model for the rest of the country. So I think, the Lord works in mysterious ways, but I think that my upbringing, as challenging as it was at times, prepared me for a lot of the moments and a lot of the crises that I've had to deal with as a doctor and as a public health professional.
Yeah, really shaped you, to be sure. It sounds like you were obviously a good student. University of Maryland, Baltimore County had a full tuition scholarship, right?
Correct. And it's one of the things that, again, I'm excited to work on at Purdue University. We want to increase the number of people of color, people from rural communities, people from disadvantaged areas that come to Purdue University. I'm someone who could have easily been written off when I was younger, even with a 3.9 GPA that I graduated from high school. I'll tell you a funny story, Gary. I went to college and I'm in this scholarship program with these other kids from Washington, D.C., and they have 4.2 and 4.3 and 4.5 GPAs. And I'm thinking, how the heck do you get that? We didn't even have these advanced placement classes that are ubiquitous now back in the rural community where I come from. But someone took a chance on me back then, gave me a full scholarship, and look where it's led to. It shows you that there's talent everywhere. You just have to have your eyes open and look for it.
Went to the IU School of Medicine, so that's what got you here to Indiana, right? And once you got your medical degree, you decided to stay in the state. What was after med school?
Well, after med school, my wife and I did a stint in California. I got my master's in public health at UC Berkeley, and that's yet another funny story and twist in life. I tell people when we lived in Berkeley, they thought I was a Tea Partier, and then I moved back to Fishers, and they thought I was a socialist. And I was the same person the entire time. But, you're judged based on your surroundings. And one of my favorite quotes is from Mark Twain. He says, "Travel is fatal to narrow-mindedness, prejudice, and bigotry." And I encourage young people in particular to travel as much as you can and to see the world through someone else's eyes, because someone who you may think is a socialist or someone who you may think is a Tea Partier, you may find that you have a lot in common with when you actually sit down and talk about just plain old life.
Yeah. Then Governor Mike Pence named you as state health commissioner. And again, a role during your time in that role, you faced some very serious crises. You mentioned the Scott County situation, the HIV, the epidemic that was facing Indiana and other states. Talk about how serious, because it seems a memory now, but how serious that was. I know the National Guard was called in. This was something that was, again, not unique to Indiana, but Indiana was among a very small handful of states where it was really acute.
Well, exactly. We were a bellwether, a canary in the coal mine, if you will, for the rest of the nation. It's difficult, as you mentioned, for people to remember this, but the country was in denial at that point. They didn't believe that this was an epidemic that could hit a rural community. They didn't believe that this was something that would go to a place that was all white, that looked like Scott County. And this situation happened, Scott County at the time had a higher prevalence rate of HIV than anywhere in sub-Saharan Africa. And
Wow.
so it really allowed us, and I say allowed us because, again, I believe everything happens for a reason. It allowed us to really raise the alarm on a national basis. It allowed us to talk about harm reduction. And syringe service programs really expanded all over the Midwest and all over the country, thanks to the work we did in Indiana. And I remain proud of that. Kentucky had no syringe service programs before we legalized them here. They're now up to over 70. Ohio doubled their number of syringe service programs. There are places like Arizona and Florida that didn't have them that have them now. And I hear people, I talk to the health commissioners in those states. They were able to get it over the finish line by saying, hey, if they could do it in Indiana with Mike Pence, then we can do it here. And so we've been an example for people moving forward from that terrible tragedy that occurred. And one of the other things that I want to do is just give a shout out to the people in Scott County. They have one of the highest viral suppression rates in the nation, meaning that those people who have HIV, they've actually all gotten on medication, or almost all of them. They've suppressed the virus, which means they can't spread it to other people. And now they can live long and healthy lives thanks to the care that we were able to provide, connecting them through the syringe service program and beyond.
Yeah. And I think I read regarding the syringe exchange program, initially you were opposed to that, right? You maybe on moral reasons, but you changed your mind.
Well, again, I grew up in a rural community. There was stigma in my community, particularly as an African-American male in farm country. And I, at the same time, was dealing, and many people have heard this, with my own brother who misuses substances. And it's hard. It is hard to love an addict. And I say that, and I'm actually quoting a person with substance use disorder who said that to me, who said it's hard to love an addict. My brother would steal from the family. My mother and father couldn't come out and visit us in Indiana because they were scared to leave the house in Maryland. And it's easy to fall into those old stereotypes, those old tropes of someone just being morally defunct. And I had to grow and learn personally and professionally. And that experience now, I speak about it very openly because I want people to understand that the more we educate ourselves and the more we educate people in communities, that addiction is a disease. It's not a moral failing. Your brain changes, but with the right treatment, we can change it back. It allows you to view addiction and view people with substance use disorder with different eyes.
Yeah. As you look at the health landscape, if you will, here in Indiana, certainly as state health have our share, more than our share of challenges with smoking, with obesity, and all those types of things. As you look at the overall health of the state of Indiana, what would you like to see happen here, or how would you assess that?
Well, I would assess it as poor. We are in the lower quartile in terms of health status relative to most of the other states in this country. And so we need to figure out how we can move the needle. And that's what I'm trying to do at Purdue in my new role as Director of Health Equity, to look at how we can give everyone a fair and equitable opportunity to make healthy choices. And I think that's what it comes down to. Again, you know by now that I love stories. Mm-hmm. My daughter's 11 years old, and we live up here in Fishers. And if she's been on the video games too long, I can say, Millie, go out for a bike ride, and she'll disappear for a half an hour, 45 minutes, and I won't be one bit worried about her. You do that in downtown Indianapolis, that's child neglect. You're putting your child at risk. Yeah. And so I have options because of where I live that are very different than people who live just 10 miles away from me in terms of lowering my child's risk of obesity, lowering my child's risk of cardiovascular disease and diabetes. And so what we need to do is create more opportunities for people to make healthy choices, for them to choose fresh fruits and vegetables, for them to be able to get out and exercise safely, for them to be able to have access to health insurance and doctors so that they can get vaccinated and get their preventative screenings, which we did through the Healthy Indiana Plan when I was State Health Commissioner.
Yeah. Before we go, I have to ask you, your time in Washington, I'm sure you could tell a million stories. And there's so many stories, certainly during the pandemic with President Trump. What was your experience like in working with President Trump, especially during the pandemic, because that was such a pressure-packed time? What were your interactions with the president?
Well, what I say about President Trump is love him or hate him, you have to realize that everybody loves him or hates him. No one is neutral
Right.
on him. And it makes it very difficult to have a conversation about him. But what I will also say is the American people elected him, and they elected him because they were frustrated with the status quo. And he's a disruptor, and he disrupted some things in ways that people didn't like. But what really hurts me is that 90+% of the people out in Washington, D.C., who I worked with, were completely apolitical. They were career public servants. And they accomplished a lot of good things. They took down unnecessary regulations. They were part of Operation Warp Speed, the greatest scientific achievement of the last 50 years. And these people who did these amazing things, they don't get credit for it because people don't want to give any positive credit to anyone who was associated with the prior administration. But one thing I will say about Operation Warp Speed is I don't think that would have been possible without someone like President Trump. He was very involved every day in there saying, when are we going to get the vaccines? I want an update. And whenever someone would offer up a bureaucratic excuse for why it was taking so long, he removed that bureaucratic excuse. I don't care how much money we spend. I don't care, what regulations we have to suspend. From a bureaucratic standpoint, what red tape we have to get rid of, get it done. And we got 3 vaccines over the finish line in record time. And so that's one example of something positive, I think, that came out of the last administration. And I hope that with time, whether or not people change how they view the things that President Trump did, and I'm not saying that they should. People are entitled to their opinions one way or the other. I hope that they do give some credit to many of the public servants who worked during some incredibly difficult times and really did a lot of positive things. When you look at telehealth expansion, we went from 10,000 telehealth visits per week to over 1 million telehealth visits per week at the peak of the pandemic, and we'll never go back. That'll be a way that we deliver care to people moving forward, and that was due to a lot of the work in CMS led by Seema Verma to deregulate and to clear out a lot of the rules that prevented telehealth expansion. So I think there are good things and bad things about everyone who serves in a public office, and I hope that we can scale up the good that happened from the last administration and really get past and move on and from the bad things that happened for the sake of our country.
You mentioned disruptors. You're working for someone who you could describe as a bit of a disruptor, Mitch Daniels, an innovator, both in terms of government, but also education. Talk about your role, your new role, because you're the first executive director of health equity initiatives at Purdue, what that's all about and what you want to accomplish.
Well, first of all, when you have a chance to work for someone like Mitch Daniels, again, it's hard to say no because he is an innovator. He is a disruptor. He's someone who does not accept excuses from a bureaucratic standpoint in terms of getting things done that need to be done for the people of Indiana. And he has said to me, I want you to come here. I want you to help us with this cluster hire. We're going to be hiring 15 new people to focus on health equity at Purdue. And we're really going to try to leverage the assets at Purdue. Purdue doesn't have a medical school, but interestingly enough, Gary, one of the things that we often talk about is that only about 15 to 20% of your health is determined by what happens in a doctor's office or a hospital. The rest of it is what happens in your community. And when you look at Purdue having a school of pharmacy, when you look at them having one of the nation's top agricultural schools and veterinary schools, when you look at the engineering programs there, and we're talking about how can we better engineer our societies to provide opportunities for health. When you look at the Purdue Extension campuses in all 92 counties across Indiana, there is a tremendous opportunity to leverage those assets to move our health status in Indiana. And that's ultimately what I want to do in my role. I want to help people understand what health equity is. It's giving everyone the opportunity to make healthy choices. But I also want to help us get on the same page. There's a lot of good going on in the state and in West Lafayette and on Purdue's campus, but we want to coordinate those activities and focus them on substance use disorder, on maternal and infant mortality, on obesity, and making sure we look at food as medicine for people across the state of Indiana and leverage the great agricultural legacy that we have here to improve people's health. That's what I want to focus on at Purdue. And I think if we can do that and partner with outside entities, not just at Purdue, but at Indiana University, at Notre Dame, at Vincennes, at Valparaiso, we've got so many wonderful academic institutions, Wabash, DePaul here. If we can really leverage all those wonderful minds out there and those passionate faculty and students, then we can move our status from 41st in the nation to in the top quartile, and maybe even one day number one for health in the nation.
Lofty goals, but I'll tell you, I can't think of a better person to be involved and engaged in trying to get us there. Dr. Jerome Adams, really a pleasure, a treat to have you on the podcast. Great to have you back in the state of Indiana as well. I look forward to seeing you soon.
Thank you. It was wonderful talking to you, and I hope to see you in person soon too.
Likewise. All right. Dr. Jerome Adams, former Indiana State Health Commissioner, former U.S. Surgeon General as well, back in Indiana. I want to thank you for joining us on this edition of the Business and Beyond podcast as well. It is a weekly conversation with achievers in business, sports, entertainment, and beyond. And you can download it and get Indiana business news 24/7. All you have to do is go to InsideIndianaBusiness.com. Thanks for joining us. I'm Gary Dick. Go out and make it a successful week.